So Rachel, what is the biggest myth about pelvic health that you encounter here at the Pelvic Model?
Well, specifically for us, I think the biggest myth is that it's only for people who are postpartum or experiencing urinary incontinence, when really it's for anybody who has a pelvis. As one of my friends told me, if you have a butthole, you have a pelvic floor. So
I love that.
Everybody has a pelvic floor. So if you have a pelvic floor, it's susceptible to dysfunction. So it's not just urinary incontinence. It could be painful intercourse, trouble having a bowel movement like constipation. It could be prep for delivery. Like we'll check you in different positions and prep you for pushing, all sorts of things. Yeah.
Across cultures, there's different styles of toilets. What are your thoughts on squatting versus sitting on toilets?
That's actually a good question. So I think you'll notice more of like the squatting toilets in Asia. And honestly, that's how we're meant to have a bowel movement. Like if we're looking anatomically, we are supposed to be squatting. You have muscles around, like let's just say for bowel movements, if this is your rectum, like a pole, you have muscles like horseshoeing around it. If you're sitting like this, like with your legs 90 degrees to your torso, that horseshoe is going to pull a little bit tighter and it's going to kink the rectum a little bit more shut, making it hard for you to have a bowel movement. But if you're squatting, it will relax that muscle. That's why squatting potties are really good.
What is your favorite analogy to explain the pelvic floor to patients?
There's a lot of analogies, but I tend to use the hammock. I don't know, the hammock is the one that's coming into mind right now. So you have pelvic floor muscles. A tip is most muscles cross a joint. For example, your hamstrings will cross your knee, and so you bend your knee to contract it, and you extend your knee to stretch it. The pelvic floor muscles is a hammock, so it goes in between your legs like a hammock, and it does not cross a joint, which is very important because to stretch it, you will technically need like manual mobilization for the muscles to be stretched, and it goes in line with your breath. So as you inhale, you have the diaphragm over here, and you also have your pelvic diaphragm over here. So if they're stacked along with your other diaphragms, which is like your glottis and your cranium, as you inhale, the diaphragm will drop and the pelvic floor will drop as well. And that's how to relax the pelvic floor. In comparison to like a hamstring, you would just like extend your knee. This one you would go with your breath.
What simple habits can people incorporate into their daily lives to better their pelvic floor health?
Oh, I love this one because I like to do a holistic approach. Of course, there is exercise, making sure your pelvic floor muscles can contract and relax, which we do go over in treatment. But there's also other holistic things that you can be doing for your pelvic floor, mainly because your pelvic floor is innervated by your pudendal nerve, which also has some autonomic nerve fibers in it. So making sure your autonomic system is good, you're sleeping well, you're eating well, you get some sunlight, like little things like that, and bringing like a holistic approach to your pelvic floor, as well as what we go through in pelvic therapy, whether you need more relaxation, more stretching, or more pelvic floor strengthening. We also recommend being a very healthy person.
What would you tell someone who's nervous about their first pelvic PT appointment?
It is very common, I feel like, because unfortunately the pelvis is still taboo. Coming to pelvic therapy isn't like going to your orthopedic physical therapist for your ankle. It could be like a little bit more scary and a little bit more like what's going to happen. But I will say, at least here in the Pelvic Model, I think pelvic PTs across the board are really good at making people feel comfortable. And here too, as we're talking and getting to know the patient, we try and align everything with their consent. It starts with like the subjective, meaning like we're asking them like what's going on with what brought them here. Asking them questions like, is it okay if I ask you about your sex life? And is it okay if I ask you like if you have penetrative intercourse, and like just going deeper in that. So asking for them for their consent up front is always key. And then it goes into when we're doing the evaluation, we tell them what's going to happen before it happens, and that puts people at ease, and they always have the option to opt out of us assessing something, even if it is internal pelvic floor work, which is intravaginal or intrarectal. But yeah, that is the best way to assess the pelvic floor, but giving them options and what they're comfortable with. It's always up to the patient on what they're comfortable with.
What are some symptoms that people often ignore that they should be going to pelvic PT for?
That's a good question. So this is for any gender. A lot of people think that they have like this chronic UTI that won't go away, or prostatitis that is just really, really stubborn. But when they go to the doctor, they get negative bacterial results. So that typically means we're landing in pelvic therapy realm, because tight pelvic floor muscles can mimic those things. So, and we're actually grade A evidence for something that's called interstitial cystitis, which is kind of feeling like you have a UTI that won't go away and you're getting negative results. That is our realm. I feel like I have a UTI and then I just go to urgent care because I want it like dealt with fast. Sometimes they don't even wait for the results to come back, and then you're already starting your rounds of antibiotics that way.
So what do you wish other healthcare providers knew about pelvic floor physical therapy?
That is a whole lot. I wish I knew a whole lot. But first, I feel like I think it first starts with telling people that we exist and letting people know what we treat and what we can help with. Because I feel like a lot of people, it comes to one of the other questions that was asked is what does pelvic physical therapy or pelvic therapy in general treat? A lot of people think it's just pregnancy, postpartum, urinary incontinence, when really it's so many things. And I think the first way, or a good way to do that, is just destigmatizing the pelvis completely and making sure that we can talk about it just like any other body part. So that if we're able to talk about it like any other body part, people will seek help for it much sooner. People are going to be comfortable talking about their body, and that will create more autonomy within themselves to seek help. And then hopefully that will trickle down to them knowing that there's different modalities like pelvic PT that can help them. Yeah.